So getting to look at these organisms, um, the next one is what? Opisthorchis viverrini. This name actually is always twisting my mouth like that, right? Opisthorchis viverrini. Okay, I get to see that this is how this organism looks like. Okay, this is how it looks like. All right, so it's actually a fluke. All right, and from this side you can see that it's flat. Okay, so it's a fluke, or you could call it a flat worm. Okay, so that this Opisthorchis viverrini is commonly known as Southeast Asian liver fluke. All right, it's a parasitic flatworm that primarily what infects the bile duct of humans. Okay, so it's in like endemic now, like places where you commonly find it. Southeast Asia, including countries like what Thailand, Laos, Cambodia, Vietnam. For the key point for the transmission, humans get infected by consuming raw or undercooked freshwater fish. Okay, so some people consume fresh fish around that side. Okay, it could be due to religious things or due to poor life or something like that. So, and sometimes if the fish contains the parasite larvae, that's the metacercariae, all right, and you don't cook it very well, you can still ingest it. For the life cycle, so that the life cycle involves three hosts. So you're having what? Freshwater snails. These are the freshwater snails. They were having freshwater fish. Sorry. From snails, it gets into the fish. Now, when you eat it, it becomes a definitive host. Human now becomes a definitive host, right? So symptoms of problems that you can get when you have this organism is what? Many infections are asymptomatic. But if you are heavily infected, you can see this guy screaming here as he's trying to defecate. So if you are heavily infected, it can cause a lot of things: abdominal pain, diarrhea, jaundice. Chronic infections can lead to what? Severe liver and bile duct damage. Okay, so there's also a risk of cancer. Okay, when you have this, right? So if it's infecting the bile duct, it can cause a cancer of the bile duct. That's cholangiocarcinoma. All right. So diagnosis is typically by what? Identifying eggs in the stools of the patient. Treatment is to use parasitic medications such as what? Praziquantel and what? Albendazole. Prevention is avoid raw fish or any other meat you are eating. Let it not be undercooked, okay? Cooked very well. The proper food processing or preparation, right? Thorough cooking or properly frozen just to kill any parasites. Therefore, improve sanitation. Just make sure that basically you control snail population, because if there is no snails, there's nothing that will push it to the fish. Do you understand? So that's it for this one. Southeast Asian liver fluke.